There's been a lot of interest in doing work to improve the way that we deliver pain management services in Saskatchewan and even to have pain management services in Saskatchewan over the last few years. And so I'll just take a few minutes to give you a bit of a rundown about the work that's been happening behind the scenes for about the last 3 years, focusing on what's happened in about the last 9 or 10 months, and then what the next steps will be, and if you would like to get involved, some really concrete ways that you can get involved too. So first question is, why do we need a provincial pain strategy? And it's very important to have something that's provincially focused, because right now we have pockets of excellence. So there's lots of people in Saskatchewan with tremendous expertise that are using that in their clinical practice, and they're providing excellent care in a certain geographical location. And we really believe that the excellence that we have needs to be shared across the province. Being able to access pain management services, whatever those services are that clients might need, shouldn't be dependent on your geographical location or having to perhaps drive very long distances in order to access those services. So right now we're in a position where pain management services are available in certain areas, but they're very fragmented, and there's not a referral process in most cases to access those resources. What we would like to see happen as a province is to have services that are integrated across the continuum of care, so for all age groups and for all aspects of care and for all types of pain. And we don't need to necessarily separate acute and chronic pain. All types of pain need to be treated appropriately and with the right service. We know that people who have persistent pain can also have acute episodes. And we know that acute pain, if it's not treated properly and aggressively, can become chronic pain. So it's not necessarily important to separate those things. It's important to make sure that we have the resources that we need in place for the people that need it. And we need them to be well coordinated. You know, as we heard from Jade and Valerie, there's a lot of work to be done to help people navigate the system and to make sure that the services they receive are well coordinated and well integrated. There are a few good programs that we do have available in the province already, and I'll just highlight a couple of them. One is the Live Well with Chronic Pain, so that's part of the Live Well series. It's a series of peer-led, usually through primary health care groups that teach you how to live well and manage your chronic conditions. And a relatively new addition to that service is the Live Well with Chronic Pain. So you can always take that back to your communities and contact your primary health care services to see if that's offered in your communities. And another good resource is an online therapy course from the University of Regina, and this is relatively new. So if you just did a little Google search about this online therapy course and reference University of Regina, it would come up. And it looks like that will be a really great resource to have available for the province, especially for people that don't live in major centers. Anywhere you have access to the internet, basically you could access this resource. So right now there are, just as an example, no formal acute pain services in Saskatchewan. And this is something that makes us a bit of a national outlier. So acute pain services are usually, as an example, found in acute care facilities, often teaching hospitals, but definitely all acute care facilities. And it's a service that's coordinated. It's usually includes anesthesia and nursing and psychology and other services. And they round daily on the patients that have acute pain needs, whether it's post-op, especially those that have complex pain needs that are in the hospital. And they provide that service to the clients to make sure that their pain is well controlled, to help manage complications, side effects, things like that. And we don't have any of those services yet in Saskatchewan, which makes us, as I said, a bit of an outlier. But I am very happy to report that Saskatoon Health Region has actually received permission to pilot an acute pain service. And if anybody in the room today is interested in knowing a little bit more of that, we do have Susan Tupper in the room, and she will be heading that up. So she's somebody that you can connect with when we're done today if you wish. So that's very exciting. This is a big step forward, and we wish Susan and Saskatoon Health Region very well and much success with this pilot, because it's something that we so need. And hopefully if Saskatoon is successful with it, then we can perhaps spread it across the province. So again, it brings us back to that provincial perspective, right? It's one thing to have a pocket of excellence, but it's another thing to make it accessible to those that are across the province. So on that note, the Pain Management Professional Practice Group has been working with various groups over the last few years, such as the representatives from the Ministry of Health, senior medical officers around the province, etc., to raise awareness of the fact that we need to do better with pain management for our population. And in November of 2015, so basically 1 year ago, almost this week, we did have a meeting of key stakeholders, which you heard from Kathy at the beginning. And the idea was to bring together everyone who we thought really needs to be involved in moving a pain strategy forward. And there was overwhelming support for it. This is a no-brainer. We know we have to do this. It's just bringing together the people, the right resources, the right energy, and moving it forward. So from that meeting, the professional practice group also developed a report. So there is a report available, and I'll tell you how you can access it just shortly. And that report just basically outlines all the possible ways that we could get to a provincial pain strategy. And then it lays out the action items too that we can take in order to do that. And in a sec, I'm going to get to the action items, because that's a way that you can get involved if you would like to. So we are continuing to meet with the Ministry of Health, and the last meeting actually was about 2 weeks ago. And it was very good because it included all the service branches. So representatives from acute care, long-term care and community, and primary health care were present at the meeting. We were able to update them on the work that's been done and ask for their partnership and express the fact that we as healthcare providers, as members of the PPG, very much want to be partners with the Ministry of Health to make sure that the strategy moves forward. So we'll continue to have those meetings, continue to keep the dialogue open, and things will move forward. It always takes time to move big machinery like a province, but if we just keep plugging at it, it can happen. After the pain strategy report, then we also developed what we call a driver diagram. And a driver diagram is just a way that we can put down in a concrete manner how we're going to action this thing. How are we actually going to do it? And as part of the driver diagram, we identified that there are really 4 main themes. And so from those 4 main themes, it's our plan to develop 4 provincial working groups. And this is where you can get involved. Those 4 main themes are, first of all, creating a pain foundation. So we would like to, at some point in the future, create a similar type of foundation that could be the touch point, the source of knowledge, a place that can coordinate education, lead public awareness campaigns, work on changing both the public and healthcare providers' perceptions about pain to help overcome stigma, etc. So a foundation that could be something similar to Pain BC. If any of you are familiar with Pain BC, they have a vibrant Facebook presence. You can also just Google it and look at the work that they do. They've been very, very supportive of us and have offered a wealth of resources. So it's possible that as part of our concrete work that we will be able to get a foundation going in that manner. The second area is education. And so if you have any interest in education or foundational education of entry to practice level for all healthcare providers, so interprofessional education for the health sciences, this would be a great place to get involved. We know that entry-level education up to now for healthcare providers hasn't included much in the way of pain competencies, and it's certainly not integrated all the way through the curriculum. So we'd like there to be an education working group that works specifically with the educational institutions to start to put those programs into place. A third area is practice. Practice really is also the big one, and that's where we need people to get involved at the health region level. through your regional quality improvement teams. Continuous quality improvement is going on in all health regions. So this is an opportune time to start a pain management committee if your health region doesn't already have one. Or if there is a pain management committee, find out how you can get involved, especially if you're a direct care provider. Those grassroots committees are always looking for energetic direct care providers to be involved to help move the work forward. And then the fourth branch will be research and knowledge translation. So those are the 4 working groups that we would like to start. And there is going to be some communication going out about those working groups in the near future, an invitation to participate. And so if you would like to be involved in what's happening with this overall strategy, I would encourage you to go to the website. So we do have a website, and it's www.saskpain.ca. It's very simple, SaskPain. And you can join the Pain PPG. You don't have to be a nurse. It's interprofessional. Anybody can join. But certainly, even if you don't wish to join, just connect with us. Let us know that you want to be involved, that you want to receive communication about what's going on in the future, and we'll put you on our communication list to make sure that you get that. The website also has the link to the pain strategy report that I told you about earlier, and it also has many other links to really, really great resources. So anytime we hit upon some good research or practice guidelines, anything like that that we think might be of use to people, we do put them on the website. Another good website for you to go to is the Saskatoon Health Region Pain Management webpage, and that can be accessed through saskatoonhealthregion.ca/pain management. And there are resources about what's available in Saskatoon Health Region there, as well as links to videos and other educational tools, and it's both for care providers and for patients. So that's all I have for you about the pain strategy at the moment. Just know that there is work going on, and if you would like to be involved, there is a place for you to be involved. So please contact us and let us know. And certainly go back to your health regions, to your facilities, to your units, and find out what you can do in those areas to be involved and to move things forward in your areas. Thank you very much.